So when I was working on this lecture I gave a lecture on clean check and strategizing is our clean check at the Invisalign Summit, and I was trying to figure out a way to put all the information I have in my head together. I came across this book called The Art of War, and it really was similar. It was talking about that how we we address the war and how we do that, and the way all the process behind, like laying the plans, identify the challenges, planning the mechanics, position a tactical disposition, forces to be used, understanding the weakness of this situation, understanding the forces to be used. Everything was similar to what I was doing when I'm thinking about preparing and set up a clean check. So I want kind of talk to you about how you can make your clean check as real as possible or as predictable as possible, because a clean check is our secret sauce. If we don't know how to plan our movement to the clean check, they're not going to happen in the real world. So we have to make sure in our clean check we're critical and we are real and we keep the contact with the reality. If we know the clean check is too good to be true, it's probably too good to be true. If we have a rotation, a 4-degree rotation, 3-15 aligner, we know that that's probably not possible in an adult, right? So we have to understand that we have to look if the clean check is too good to be true, thinking about what we know about braces, right? If a class 2, can a class 2 be corrected in 5 months? No, it cannot. So why that would be possible in Invisalign? The mechanics and the teeth respond the same way. So if the class 2 cannot be corrected in 5 months with fixed appliance, it probably cannot be corrected with removable appliances. So we have to think about that. What I do usually, I remove every unwanted, unnecessary movement. So if I see a clean check where I have unnecessary tipping, unnecessary extrusion of the lateral, unnecessary rotation, I eliminate the movement. The more we strategize, the more we let the plastic, we empower the plastic to do what we want to do, we need to do, the more we avoid to do movement that are necessary, and the forces of the plastic are going to be really addressed and focused on what we want to do, and nothing is unnecessary. You probably notice sometime when you see your clean check coming back, you will see maybe a molar on the top getting extruded and a molar on the bottom getting intruded. So at the end of the day, we got 0, right? So sometimes we need to figure out that some of the movement that the technician does, they're unnecessary. For whatever reason that happens, we need to really be critical in our clean check. So the first thing I do, I eliminate anything I don't want, okay? So another important thing that I do is I split the movement. So I call it divide to conquer. So if I have an open bite, I will do a little bit of intrusion on the top, a little bit of intrusion at the bottom of the posterior teeth. I will not do all the intrusion one arch or the other. So I'm trying to kind of split the difference. I will extrude the lower anterior, extrude the upper anterior, and then I will incorporate already throughout the treatment some mechanic of elastics to correct the lateral open bite. So I'll do all those things already. I implement all those mechanics. So I'm proactive with my mechanics. I don't want to get to the end and say, oh, but the intrusion didn't happen, or the extrusion didn't happen, so I want to create all those mechanics already while I create the clean check. So I spend a lot of time in my first clean check to strategize everything from the get-go. So one thing also we do in our practice, we use a lot of overcorrection aligner. The overcorrection aligner are used for us, for example, to overcorrect hard movement. When you see those blue and black dots, so we use to just make sure that we get all the movement that we want. We use to space closure if we have some extra space that we need to close after the IPR, and sometimes we use for boosting mechanics. So there is a lot of way we use overcorrection aligners. Sometimes we give an extra overjet, and then we reduce the clearance if the dentist or the patient decide not to do restoration. So we leave extra room for restoration, and then they say that they decide not to do a restoration anymore and they don't need all the extra overjet, we just close the space. So there are a few things that we implement. One thing important during our clean check setup is make sure we remove any interference. So the teeth don't move if there is interference among each other or among the opposite arch. So something important that we do, we work on differentiate and stabilize, define when do we move and how we move certain teeth. So in this particular case, for example, you will see we have a Brody bite on the upper right second molar. So what we're gonna do is first distalize the wisdom teeth. I know that's weird, the patient didn't wanna have those removed. So we first distalize the wisdom teeth, then we intrude the upper right second molar, then we'll finally procline the lower right second molar. So it's all defined in our plan. Otherwise, the teeth will hit against each other and it will not get corrected, okay? So that all strategies are important to get the treatment in 12 months and without additional liner. This is a Brody bite with a lot of crowding corrected in 12 months with no additional liners. So the same thing happens when we want to correct rotation. We need to make sure we have enough clearance around the tooth to rotate. Also, when we have very difficult movement, having space among the teeth, it's really important. The more plastic we have around the teeth, the better the teeth will move. So we have a much better root management control if we have space among the teeth to move. And so you can see, case structure, upper bicuspid extraction case treated, and in refinement, you can see we're almost done, and then the final case. We engage additional forces when we have severe rotation. We incorporate that out to allow for the rotation. So we know that those are challenging movements, so we anticipate that, and we already prepare for the difficult movement by engaging additional forces. Sometimes we had expansion. Let's say we know sometimes Invisalign may have our time expanding the teeth, especially when we have to do some severe expansion. Sometimes we had a removal expander, so we take an impression with the aligner in, and we had the patient activate the expander every time they change an aligner. So we give it some boosting mechanic to make sure the aligner, if they don't have the forces to do the kind of movement that we want to do, we just add some more forces to it. And so we can have predictable amount of expansion. Those are cases where we do PAO, so the expansion has to happen very quickly in a short period of time to use the PAO effect. So sometimes we incorporate biplate retainer. So we know that the challenge in Invisalign is opening the bite is very complicated. So we had some biplate retainer at nighttime, which is gonna kind of negate some of the intrusive effect of the plastic. So all of those are things we incorporate in our treatment plan to make sure we get to the final result we want. Sometimes we use plates for distalization of the lower arch, which is very difficult movement to accomplish when the patient doesn't want to wear plaster elastics interarches. Sometimes we use power arms to help the rotation of the tipping of the molar, when again it's a very complicated movement to do in Invisalign. We have to be proactive about it. And one important thing about being efficient and predictable is make sure we keep the patient engaged. So use a virtual monitor to help us to get the patient always engaged in the treatment, so they know they're being watched and they know they're going to be compliant.